Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Pinch yourself. This is not a dream. It's the first proper week of spring. And after the long Nordic winter, people are out in the parks, mixing, mingling.
I work as a midwife at the hospital here in Stockholm. I just came from my night shift, so I woke up quite recently, and it's such a freedom to just be able to be here at the open field and with the sun, the blue sky, and the wind, just to clean your mind a little bit.
Stockholm feels like a parallel universe, where life, as we all once knew it, continues as if unchanged.
I think there have been a huge overreaction in most countries around the globe. They're doing the wrong thing. That's what I think. They should be doing more like Sweden does.
Government advice is this: keep your distance, and if you feel sick, stay at home. The priority, to protect the elderly and the vulnerable. But otherwise, Swedes are free to do almost all the normal things that, to an outsider, now feel dangerous. Subversive, even. There is a bit more nuance to this than meets the eye at first. Yes, a lot of the cafes and restaurants are open, but they have taken measures. It's table service only. They're leaving big gaps between the tables. One guy I just spoke to said, yeah, I'll come out for a drink. Yes, I'm going to work during the day, but I wouldn't go and see my grandmother. Swedes have been told to be careful about their social interactions, and it looks like lots of them have been taking that very, very seriously. This city is much quieter than it would usually be. Here's how social distancing works in the lunch queue at primary school. It's more an aspiration than a rule. They've taken other measures too, spacing out the desks, avoiding activities with too many kids together. Schools in Sweden are not just open, attendance is compulsory for children up to the age of 16. For the head teacher at this school, an immigrant from the Philippines, it's been a challenge.
I think it's the worries actually from the parents, I would say. But then when they have seen that I actually make sure that I follow recommendations from the health authorities, I mean, they accepted that. And I think it's actually rooted in the culture, you know, that's something that I've actually noticed, that when it comes to trust and respect, it's quite as solid in Sweden.
Trust is at the heart of the Swedish strategy. Social distancing measures are requested, not dictated. And in return, most citizens, more than 75%, according to a recent poll, have faith in the authorities' approach. So this is the Public Health Agency of Sweden. This is where Sweden's coronavirus policy is made. Anders, I'm Gabriel. The man leading that strategy doesn't talk explicitly in terms of herd immunity, but that is effectively the plan. Anders, I spoke to you, I think, about 3 weeks ago. And I said, are you sure you're taking the right approach? And you said, come back to me in a few weeks' time. So how are you feeling now?
I think to great parts we have been able to achieve what we set out to achieve. I mean, Swedish healthcare keeps on working, basically with a lot of stress, but not in a way that they turn patients away. What has not worked out very well is our death toll. And that's very much, I mean, it's partly due to the strategy, but not really very much. It's mainly due to that our elderly, or homes for elderly, have not been able to keep the disease out. So the deaths is obviously one of the key things where you want to get a good outcome. Is there a part of you that is thinking, have we got the right strategy here? Yes, of course, always there is, but still, almost 50% of the deaths takes place in elderly care. From our point of view, it does not disqualify our strategy as a whole.
If you are basing your decisions on different data from the rest of the world, what is the data that you are basing your decisions on?
But I think the question is, what data does the rest of the world base their decisions on? I think that's just as relevant. And we've been looking around, and there's very few things around that. There is the report from Imperial, a non-peer-reviewed report. That's one of the few things that you can find. And in most countries, you find nothing.
The outbreak in Sweden is concentrated in Stockholm, but there are big variations by district.
I think it's a little bit weird that we're moving around and not taking proper precautions.
Here in Rinkeby, where the overwhelming majority is from an immigrant background, the number of recorded cases is almost 3 times the capital's average.
Vi har bara info. Ja, vill du ha? Nej, okay. But you see, everybody comes by and would like a test. And because it says in the newspaper that they want to increase their testing capacity to 10,000 a week, but we haven't seen a single test yet. But everybody has these symptoms that last for weeks and weeks, so we can just assume that it's Covid-19.
Today, the Public Health Agency estimated that by the end of the month, a quarter of the capital's residents may have been infected with Covid-19. Progress towards herd immunity? Perhaps. But the truth is, no one knows the real numbers. I've spoken to a doctor who works with COVID patients at a hospital here. He didn't want to appear on camera, but he told me, I'm afraid. He said, there are so many things that we don't know about this virus. Why are they taking this risk? They're gambling with people's lives, he said, and they're gambling with the lives of those who are trying to save lives. Now, others in the scientific community are coming forward to voice their concerns. One of those is Lena Einhorn, a virologist, one of 22 scientists who've signed a letter urging the government to change tack. She's self-isolating here in the countryside outside Stockholm. You comfortable there?
Yeah.
I'm going to be about here.
There are thousands of trials going on right now around the world for treatments. We're not talking vaccines. We're talking antiviral treatments. We're talking about the treatments of the devastating effects of the infection. Already, there are a couple of drugs that have showed very, very promising results in small trials. Within the next few weeks and months, most likely, we will be able to lower the mortality. That, to me, is the most important reason to push this epidemic in front of you as far as you can.
These people who are deciding this, they're not politicians, they're scientists, like you.
Yes, it's just the problem is that scientists are people. And, scientists have ideas that they cling to. You would be surprised how much science is not only ruled by rationality, it's ruled by feelings to a very large extent.
Compared to Sweden's neighbours, the numbers don't look good. Deaths from COVID here are 3 times higher than in Denmark and 6 times those of Norway and Finland. Those countries have imposed strict lockdowns.
I think it's too early also to say is a lockdown good or bad, because many countries are now having a discussion within the political sector, but also in the whole society. Should we lift the restrictions? In what way? What will happen? That is not a debate in Sweden, and it's not something the government is preparing for. We are not lifting any restrictions for the moment.
But if you look at your numbers compared to your neighbours, Denmark, Norway, Finland, it looks bad. Per million in population, this is a direct comparison.
I don't fully agree with that, because how to have the statistics, but also where are we, in what kind of phase for the pandemic are we for the moment?
Do you think you're earlier? Do you think you're further along?
We're not sure about that, but that could be a fact, and I think it's too early to evaluate that now.
If lockdown is a treatment that's being trialled globally, then Sweden is the control group. This is not about going out and getting your hair done or meeting your mates down the pub. This is about whether the course the rest of the world is on is sustainable or even beneficial in the long term.
I don't think we'll have more deaths. Come back 1 year from now and I think we'll have the same proportion of deaths.
But this is a hunch?
It's likely. I mean, this is a virus.
That's a hell of a thing to base your hunch on.
Yes, maybe, but just wait a couple of months and the death toll in the UK will be going up compared to Sweden.
It will be some time before we know whether this hunch is proved right. For now, it does feel like a big gamble.
Gabriel Gatehouse there. I'm joined now from Geneva by Dr. Margaret Harris, who's the spokesperson for the World Health Organization. Good evening. What is the World Health Organization's take on Sweden's decision?
So we don't say that you have to do lockdowns or not. What we say is essentially you need to be testing. You need to be separating, finding your sick, the infected people, and separating them from your healthy people. And there are lots of ways to do that. But first of all, you need to be testing to find out who is sick, and you need to be contact tracing to ensure that you find all the people who are potentially sick. And then, yes, you need to be doing different social distancing measures, but different countries are doing it in their own ways. Not every country has gone into what's called a lockdown, we call public health social measures. And also the question then is, when you've had a lockdown and in many cases, countries have successfully slowed down their epidemic, what do you do next? Because it's just buying you time. What you need to do is to ensure that you do know where the virus is and you can stop that transmission.
In the UK today, we've had more details on test and tracing, which seems to be the direction of travel. Are you surprised that this is where we are at week 4 of lockdown? Would you thought this should have been earlier, a more nuanced response like you were describing?
Certainly in countries that have got their surveillance going very early and have really ramped up their testing and their contact tracing. People seem to forget the contact tracing. They look to Wuhan and look at the lockdown and think that was the big thing, but they forget that what they also did in Wuhan was rigorous contact tracing and separation, again, of the people who were potentially infected. All I can say really is that's very good news that that's being ramped up, and that will really help you get your outbreak under control.
How soon will we know whether Sweden's measures or decision around this have worked better than, let's say, our response in lockdown?
I think we're all going to be watching each other. I thought it was very interesting what was said about the control group. I wouldn't want to see any country as a control group, but we will all learn from each other. We will look at what worked here, what worked there. But whenever we look at this kind of evidence, we also have to understand the context. What was acceptable to a society? What would people do? And I think it was noted that this is a society where people are very trusting in what they're asked to do. So it varies. Singapore took this approach. They have now changed and gone to what they call a circuit breaker because they've had large clusters of cases in migrant worker dormitories. So it really does vary from country to country and context to context.
There's a growing concern about the number of those from ethnic minorities dying with COVID-19. We've got more reports in the UK press coming out tomorrow. What does your research at the World Health Organization say about that?
So I would say the research is really in a state of evolution again, because what you have is more anecdotal evidence. So from different countries, they are seeing that some groups certainly seem to have higher rates of illness and death. But is that a result of social conditions? Is that genetic? That's not clear, and it really won't be clear until we can compare a lot of countries and a lot of groups and see some similarities, some inconsistencies.
In order to do that, you need money. And of course, there was the news of Donald Trump's defunding of the World Health Organization, of course, by America. What will that do to your work?
Well, any problems with funding from any source always makes it more difficult, but we will, of course, continue our work. The world is working together right now, and this is about solidarity, the science, and finding solutions. And nothing is going to stop us from driving forward and doing that.
But the US, being the size that it is and the contributor that it is to the WHO, will have a significant impact, I'm sure, on some of your work. If it's not the pandemic, it will be other things that have to fall by the wayside. What are they?
So that is always a concern. And again, we have many, many programs going on. As you quite rightly say, babies are being born every day. People are getting ill from many, many other illnesses. Immunization must go on. We're concerned that many immunization programs have been stalled because of inability to get children to be immunized because of sort of slowing or stopping of medical services. So funding or otherwise, there is a lot of other health work that must continue.
Are you concerned? We've had a report this evening trying to look at the lack of protective equipment specifically for those working as carers and in care homes and going from home to home. This is, of course, the site of the most vulnerable. Are you concerned about the lack of planning specifically for those groups in countries around the world?
We are really concerned about everybody around the world getting access to good protection. And in fact, a huge part of our work now is organising supply of not only personal protective equipment, though that is a huge need around the world, but also things like the reagents for testing, oxygen for people who are needed in hospitals, and ventilators and equipment. So we've actually put together a supply chain with the different agencies. We put flights together with the World Food Programme because they have an air system. So we've set up an air bridge to all countries around the world so that we can get those things to people around the world. But it is a very, very important need.
Dr. Margaret Harris, spokesperson there for the World Health Organization, thank you for your time this evening.
I've been getting